So we're hoping that we can take the promising data that we're getting now and continue to work and evolve with it. And we want to use artificial intelligence, we want to use machine learning, and we also want to utilize biomarkers to figure out which men would be at high risk, both from a genetic factor and family risk factor perspective. So with all these new tools available for us, we're going to make tremendous strides in advancement with prostate cancer. We're hoping that men are not afraid of getting tested because, in addition for appropriate detection, it opens the way for focal therapy. Just the way women focused on eliminating mastectomy or having the breast removed if they had a small tumor for conserving the breast, now there's growing evidence that men with small volume intermediate grade disease can be treated with focal therapy, removing the cancer with heat, leaving the gland intact, reducing the side effects, and thereby encouraging men to get tested and reducing the harms. The U.S. government, again, in my opinion, has created a challenge or a landscape that makes it hard for men to get tested. Physicians are ordered to have what's called shared decision making if they want to have a PSA blood test. They can't just check off on the box, get a PSA blood test like they do for hemoglobin, for cholesterol, for blood sugar. You have to get consent with the patient before you can even draw a blood test. That's ridiculous. This isn't being done when they check your cholesterol, and yet if your cholesterol comes back elevated, the medications used to treat the elevated cholesterol have significant side effects and complications. If you have an elevated fasting blood sugar, then you need a follow-up study called an A1C, and getting put on medicines to maintain your blood sugar are complicated. So why is the PSA blood test being singled out as the only blood test that requires shared decision making? So we're trying to encourage men that September is Prostate Cancer Awareness Month. Learn how to fight like women, be aggressive, be informed, ask questions, but don't be afraid to get tested. PSA screening can save lives, and we want to save yours.